Welcome to this explainer. As a cardiologist, I see a lot of things, but today I want to guide you through one of the absolute highest stakes medical emergencies the human body can ever experience, a heart attack. We're going to break down exactly what happens inside your chest, how you can recognize those absolute earliest warning signs, what emergency treatments actually look like on the front lines, and most importantly, how to protect your healing heart long-term. Let's get right into it.
Okay, let's dive into this. Right now, your heart is beating. It's this extraordinary engine that just tirelessly pumps life-giving blood to literally every corner of your body. But what happens when that engine's own fuel line is just suddenly cut off? Well, in medical terms, we call this a myocardial infarction. Essentially, it's a sudden catastrophic drop in blood flow to a part of the heart muscle itself. And when this happens, it is a rapid race against the clock. Every single passing minute without oxygen means the potential for permanent, life-altering damage.
Section 1. Anatomy of a heart attack. Let's look at how this actually starts.
To truly understand this crisis, we really need to zoom right in to the microscopic level, deep inside your coronary arteries. The primary culprit behind these life-threatening events is coronary heart disease, and it unfolds in a very specific biological cascade. Step 1, over years, cholesterol plaque slowly builds up along the artery walls. Step 2, under stress, or honestly, sometimes without any warning at all, that plaque ruptures. Step 3, your body reacts to this rupture just like it would to a cut on your skin. It instantly forms a blood clot to seal it. But inside a narrow artery, that clot acts like a concrete roadblock. It completely stops blood flow. Finally, step 4, without that oxygen-rich blood, the heart muscle simply begins to die. In cardiology, we have a saying, time is muscle. The longer the heart goes without blood, the greater the irreversible muscle damage. It's really that simple.
Section 2. Recognizing the warning signs. Because knowing what's happening on the inside only helps if you spot it on the outside.
So zooming back out to the human level, how does this microscopic crisis actually manifest as physical distress? Well, a heart attack doesn't always look like it does in the movies. You've got the classic symptoms, right? That intense crushing pressure right in the center of the chest, pain radiating down the left arm or maybe up into the jaw, and sudden shortness of breath. But you absolutely must also be aware of the atypical symptoms. Things like unexplained nausea, unusual and sudden fatigue, pain localized in the back or shoulder, or even a sudden severe feeling of anxiety. And what is absolutely crucial to understand here is that women are much more likely to experience these atypical symptoms. Being able to recognize these less obvious signs, it's vital for getting help before it's just too late.
Section 3. The silent threat. Because sometimes the body doesn't scream for help.
Now, what's really interesting about this slide is, what if your body doesn't send out loud, recognizable alarm bells at all? A staggering 45% of all heart attacks are what we call silent myocardial infarctions, or SMIs. This means they happen with symptoms so mild or brief, maybe just a fleeing discomfort in the chest or feeling slightly lightheaded, that they're completely brushed off as simple indigestion or just being really tired. But make no mistake, a silent heart attack is still a real heart attack. It leaves actual scarring and damage to your heart muscle. Because people so often ignore these mild symptoms and don't seek immediate medical care, they carry a 3 times greater risk of dying from coronary artery disease if left untreated. A silent heart attack is literally a loud signal from your body that you have an underlying health issue that desperately needs attention.
Section 4. Emergency response and treatment. When the unthinkable happens, what do? Whether the symptoms are a loud siren or a quiet whisper, what is your immediate plan of action? Let me be as direct as I can here. Minutes matter. If you or someone else experiences these symptoms, never delay to just take an aspirin and wait. And absolutely never try to drive yourself to the hospital, because you could experience a fatal arrhythmia right behind the wheel. You must immediately call 911. This timeline maps out what we call the golden hour of emergency cardiac care, and it starts with your call. When EMS arrives, trained paramedics will perform a pre-hospital 12-lead ECG. They can actually transmit these heart rhythms directly to the hospital while you're still in the back of the ambulance. This allows the emergency department and the specialized cardiac team to completely prep for your arrival. Plus, during transport, paramedics can manage life-threatening arrhythmias on the spot. By the time you reach the ER doors, the team is already set to bypass delays and move you straight to the cardiac catheterization lab.
And there is a very strict stopwatch ticking during all of this. As outlined by the 2025 American College of Cardiology and American Heart Association clinical guidelines, the benchmark goal is getting the patient from first medical contact to a first device intervention in 90 minutes or less. To put that into perspective, every 30 minutes of delay increases the relative risk of one-year mortality by 7.5%. That 90-minute window is absolutely the ultimate goal for saving your heart muscle.
So, what exactly is happening at the end of that 90 minutes? The intervention is called PCI, or percutaneous coronary intervention. When you reach the cath lab, an interventional cardiologist will perform this incredibly precise non-surgical procedure. Using a super thin tube called a catheter, they navigate right up to your heart. Interestingly, the latest 2025 clinical guidelines strongly prefer entering through the radial artery in your wrist. This significantly reduces bleeding complications compared to the older method of going through the femoral artery in the leg. Once they find the exact blockage, they inflate a tiny balloon to basically crush the plaque, and they place a wire mesh stent to prop the artery open, instantly restoring blood flow. Afterward, to keep that stent open and prevent any new clots from forming, patients are placed on dual antiplatelet therapy, usually aspirin plus a medication like ticagrelor, for optimal, long-term outcomes.
Section 5, Recovery and Long-Term Prevention. Getting out of the hospital is just the first step.
Restoring the blood flow saves your life in the acute moment, but surviving the crisis is really just the beginning of your journey. You must actively protect your healing heart. So the crucial point is to follow the evidence-based Million Hearts ABCs of secondary prevention. A is for aspirin for people at risk, keeping your blood flowing smoothly. B is for blood pressure control, which takes the physical strain right off your recovering heart walls. C is for cholesterol management. The new guidelines stress the use of high-intensity statins and sometimes even additional non-statin therapies to aggressively push your bad LDL cholesterol levels down to prevent new plaque from ever forming. And finally, S is for smoking cessation, which is absolutely mandatory, no exceptions. Combined with a dedicated cardiac rehabilitation program, adhering to these ABCs will dramatically lower your risk of ever ending up in that cath lab again.
Your heart works tirelessly for you every single second of your life. It's an extraordinary, resilient, and beautifully complex engine, but it can only take so much silent wear and tear before it reaches a breaking point. So I leave you with this. Are you listening to the warnings it sends you? Whether it's prioritizing a healthier diet, finally getting your cholesterol checked, or simply refusing to brush off that odd, fleeting chest pressure, proactive cardiovascular health isn't just about surviving. It's about giving yourself the chance to live fully. Pay attention to the signals. Thank you so much for joining me for this explainer, and please, take care of that heart of yours.